Thank you so much. I am so happy to be here and to get a chance to meet all of you. Thank you, Claire. Thank you, Sean. Thank you, Mito Foundation, for bringing me. Like they said, I'm a clinician. I take care of people, children and adults with mitochondrial disease. It is my passion. My goal in life is to help find really good treatments for people with mitochondrial disease to improve your lives, your quality of life, your longevity of life in my career. And that's where my passion is, and that's what I focus on. I was very fortunate this morning to get a chance to talk to some of your fantastic scientists about some of the emerging therapies that are out there. And I'm excited to say that there are emerging therapies out there. There's a lot of them. When I started doing this 20 years ago, there weren't. In fact, one of the things that really roped me into mitochondrial medicine was a young lady I met with a mitochondrial disease. And I was so excited when we diagnosed her because I thought, oh, good, we know what she has now. We'll be able to treat her. And I very quickly realized there was no treatment, no therapy, absolutely nothing we could do. And I said, this is not right. We're doctors. We're supposed to treat people. And that's actually how I got into mitochondrial medicine in the first place. So one of the biggest concerns that a lot of my patients have and that we face on a day-to-day basis in mitochondrial medicine is, what do you do when you get sick? And how do you keep me or a patient out of the hospital? Because we don't want to go to the hospital. Nobody wants to go to the hospital. Claire asked me to talk about this. I thought, well, this is a very, very difficult topic because it's very individualized for patients. There's a big difference between a 6-month-old baby who has Lee syndrome versus a 45-year-old woman who has Kern-Sayer syndrome. So how do you take a topic that's so individualized and generalize it to make it relevant to everyone? So hopefully I've done a decent job of doing that, and I hope that everyone is able to gain some information. And I do give personalized talks to my patients on this. There are a lot of common themes that I hope will make sense to everybody. And I'm hoping that I've left a lot of time for question and answer because I do want to be able to help individualize questions if we need to. So the first thing I always tell my patients is that in order to understand why mitochondrial disease makes you feel bad or makes you sick, you have to understand a little bit about your body. So your body is made up of parts. We all know that. You have a brain, a heart, lungs, stomach, liver, different parts. And each of those parts is made up of parts. So if you take your heart and you break it down, it has different parts, the ventricles, the atria. Then if you break each parts down, there's other parts. So there's cells within your parts that make up each part of the parts of the parts. And inside the cells, there are even more parts, okay? And some of those parts, they're pointed on here. Yeah, okay. So some of those parts are mitochondria. So these are all the different types of cells that are inside those parts. And then inside the cell are a bunch of more parts. And one of those parts is the mitochondria. And that's the one we care about. And if the mitochondria don't work right, then you have a mitochondrial disease. It's really just that simple, okay? So when people talk about having heart disease, I say that's just too easy. The heart's big and everybody can see it. We're talking about having a mitochondrial disease. It's small, it's very specific. So the main job of your mitochondria is to take your food and turn it into energy in the form of something called ATP, which is a chemical that your body uses to make all the other parts work. So if your mitochondria don't work, you don't produce ATP, nothing else in the body is going to work properly because it is the one of the basic parts inside the cells that are inside the organs that are inside the body. So in order for your body to function properly, your mitochondria need to work. And when your body needs more energy, it turns your mitochondria on to produce more ATP. And when your body doesn't need energy, it slows it down and turns it off. So this is the simple process that happens. You have chemical energy in the form of food, carbohydrates, fats, proteins. We all eat those things. They go in, they turn into energy, and they go out. They go out as heat, free radicals, and other waste products. So for everybody, when you take your food and turn it into energy, you make certain waste products. Heat, something called free radicals, we'll come back to them, and chemical waste products. Depending on how well your mitochondria work, you're going to do this better or worse than other people. So everybody has a level that they do this at. It's like any chemical process. It's like any manufacturing process. Some people do it better than others, but everybody has to be able to do it, or else you wouldn't be able to be alive at all. So the better you do it, the more energy you get and the less waste products you get. People with mitochondrial disease have varying degrees of dysfunction of this system. And so they have varying degrees of less energy being produced and more waste products being produced, just depending on what type of mitochondrial disease you have and where you are in your disease process. So let's talk about the free radicals. Nobody likes the free radicals. Look at how mean they are. So what they do is they go around your body and they attack other things in your body or in your cells. So they attack all of the other parts inside your cells, your cell membrane, they attack your other organelles, they attack your nucleus, and they damage them. And ultimately what they do is they kill your cells. So obviously, the more free radicals you have, the worse it is. The less free radicals you have, better. Free radicals are a natural part of mitochondrial processes. Everybody produces them. It's actually what causes aging. So you hear a lot about antioxidants, and everybody should take antioxidants. Antioxidants will keep you young. Put antioxidants on your skin. It's going to make you look young. Really what you're doing is you're attacking these free radicals in your body and trying to get them to go down. So everybody produces free radicals. It's part of the normal mitochondrial process, but people with mitochondrial disease produce them at a higher level, and therefore they have more oxidative stress inside their cells, and they create more damage with their free radicals. So again, if you have a healthy mitochondria, you can produce lots of energy and very few free radicals. Unhealthy mitochondria are going to produce a little bit of energy and a lot of free radicals. So everybody's on the spectrum somewhere between these two. And depending on where you sit and depending on how things look today, you may produce more energy or more free radicals. So whatever the reason that you have your mitochondrial disease, if your mitochondria aren't working, you don't have enough ATP. You're not producing the amount that you need to function at the level you need to be functioning. And without that, your cells don't work, so your organs don't work right. And so ultimately, the body isn't functioning to the level it's supposed to be functioning. In addition to that, you have a buildup of toxic waste products. So some of those are free radicals. Another toxic waste product that we see in some patients is lactic acid. And I'm not going to go into why that's produced, but it's produced in some people. And lactic acid in and of itself, for some people, can create some symptoms, things like shortness of breath or pain in your muscles. So what happens when you get sick? Well, if you think about someone without a mitochondrial disease when they get sick and they get the flu, and they get really tired and they want to lay down in bed and they are spending all of their energy fighting off this illness because it's exhausting. You have this virus running through your body, taking up all of your energy, and you're doing two things. You're trying to fight it off, and the other is you have a fever that's making you feel bad, and it's creating weakness. And so if you have a mitochondrial disease, you already are starting at a state where you don't have enough energy. And now your body is trying to make you produce more energy. So if you take a person without a mitochondrial disease and they get sick, they often end up laying in bed for 3 or 4 days. Now take someone who has a mitochondrial disease and they get sick, they're going to be depleted to a position or a point beyond someone without a mitochondrial disease. They may reach a point where all of a sudden it starts affecting their ability to pump their heart or make their liver or kidney work because they can't even keep up with that need to fight off that infection. So again, when someone without a mitochondrial disease gets sick, they say, I need more energy. I'm going to turn my mitochondria on and I'm going to make more energy. And so they do, and they start producing lots of energy and they start producing a little bit of free radicals. But if you have a mitochondrial disease, and I always tell my patients, it's kind of like your tires are spinning. So you have a mitochondrial disease, your mitochondria are not working. You can only make so much ATP. So what happens is you start trying to make more ATP and you can't do it. And it's like the assembly line that's going nowhere and everything's just falling off the end of the line. You start trying to produce more ATP, your mitochondria start turning in circles. And what ends up happening is you're not actually making ATP, but you are making more oxidative stress. You're making more lactic acid, you're making more free radicals, but you're not actually producing any more ATP. So your body ends up in a state where it thinks that you need to be making more energy. It turns up your mitochondrial function and it puts you in a position where you're spinning your wheels. So you end up making just a little bit of ATP and a lot of free radicals. So you end up with all of this oxidative stress again, and it causes a lot of damage to your cells, which is not a good thing, and it can actually make you worse. So this is one of the reasons why for patients with mitochondrial disease, it can create a dangerous situation when you get sick. It's why a lot of times we say, you have your most risk to have a regressive episode or to have a severe decline or some sort of organ failure during a time of illness. This is a very demanding time. Your body becomes overwhelmed with the illness. It tries to produce more ATP and it ends up spinning its wheels and actually doing more harm than good. So what do you do? And again, this is the generality part of this. So for every person, I'm going to start with a disclaimer. You're going to talk to your mitochondrial specialist and you're going to come up with an individual plan for yourself. But there are a few things that make a little bit of sense. So in medicine, we talk about these processes called catabolism and anabolism. So catabolism is a state where you're under stress and you say, I need more energy. So for whatever reason, like being sick, your body thinks it needs more energy and you want to turn up your ATP generating system. So everything's spinning and running and trying to go. And in doing this, it leads up to this buildup of toxic products. So here's your wheel spinning, not going anywhere and producing all of this nasty byproducts. Anabolism is a really nice state. It's when your body says, you know what, I'm happy. I can make my ATP. I'm nice and restful. I can do this slowly. Everything is fine. I don't need to turn anything up. Well, when you're sick, you become catabolic. You turn everything up and your body starts revving up this system and it starts thinking that it really needs to produce this ATP and you start spinning your wheels. So what we want to do is we want to trick you back into a state of anabolism. We want your body, we can't make you not sick. That doesn't work a lot of times. But what we can do is we can trick your body into thinking that you're not sick. And we can make it think that you're happy and safe. And so sugars are the best metabolic trick we have. If you increase your sugar intake, then what you can do is you can trick your body into thinking that it's nice and happy and calm and that it doesn't need to make ATP anymore. And so we tell our patients to start drinking a lot of sugary fluids. And I will tell you, the kids love me. I'm always telling their parents, go get them Gatorade, not the low-cal stuff. Go get them Kool-Aid, get them anything that's got a lot of sugar in it and have them drink that, because we want to keep them hydrated and we want to give them a lot of sugar. And the hope with that is that what it'll do is it'll trick your mitochondria into thinking everything's okay, and it'll turn off this system of spinning wheels. So what you should do, and again, talk to your doctor, but decrease your overall energy demands. Don't push yourself. You know, I can't tell you how many times I have said to my son, get up and go to school. Okay. He doesn't have a mitochondrial disease. If you have a mitochondrial disease, don't do that. Rest. Don't push yourself. Pushing yourself is just going to make it worse. Okay. So don't push yourself. Keep your fever down. Fever is an energy demanding process. So keep that fever down. Be very aggressive with your fever control and stay hydrated, stay nourished, and drink a lot of sugar. Okay. And again, I'd like to thank everybody. I'd like to thank the Mitochondrial Medicine Society in particular. I'd like to thank the Mito Foundation for bringing me here. I'm so excited to have this opportunity to talk with you guys. And I'm going to give a plug tomorrow. I'm talking about epilepsy and how it affects patients with mitochondrial disease. So I am happy to answer any questions that anybody has.